Welcome to this video guide on staying healthy as we age. This guide offers simple, practical information on prevention and health promotion for older adults, designed to help you live a full and independent life. This guide uses clear, everyday language to share proven, practical steps. It's meant to be a helpful resource for older adults and their loved ones, providing a foundation for meaningful conversations with your doctor or healthcare provider. You have more influence over your health than you might think. Many illnesses can be avoided or delayed through healthy habits like balanced eating, regular activity, and managing stress, even later in life. This video centers on two key concepts: health promotion, which is about building up your well-being, and prevention, which focuses on heading off problems. You need both to truly protect your health. Health promotion means taking charge of your daily life. This involves learning about your health, creating a safe and supportive home environment, staying socially connected, and focusing on wellness rather than just treating illness. Prevention focuses on lowering risks, catching potential issues early through regular checks, and managing conditions effectively. The goal is to be proactive about your health rather than just reacting to problems later. Everyone's aging journey is unique. Whether you are aging well, managing an illness, or need more support, every situation calls for a slightly different focus. Most older adults live full lives with at least one chronic condition. For most of us, staying in our own homes and communities is the goal. Aging in place supports better health, well-being, independence, and vital connections with friends and family. There are 3 levels of prevention: preventing problems before they start, catching them early, and living well with existing conditions. Together, these strategies help add years to your life and life to your years. Level 1 is about stopping problems before they start. If you feel well, the goal is to remove risks through healthy habits like not smoking, staying active, eating well, and keeping up to date with vaccines. Level 2 focuses on catching health problems early. Routine screenings for blood pressure, cancer, bone strength, and mood check-ins can help you handle issues when they are easiest to treat, keeping you feeling well. Level 3 is about living well with existing conditions. By understanding your health needs, working as a team with your providers, and keeping up with follow-ups, you can maintain control and independence. Looking ahead, we can protect 5 key areas of our health: preventing disease, staying strong to avoid frailty, preventing accidents, ensuring safe medical care, and supporting our emotional well-being. 2 things that help almost everyone are staying physically active and getting vaccinated. These simple, proven steps lower the risk of illness, prevent frailty, and protect your long-term independence. We are now ready to explore our first major area of focus: preventing and catching disease early through regular screenings, recommended vaccinations, and sustaining healthy daily habits. Let's begin with screenings. A screening is a simple test that looks for health problems before you have any symptoms. Finding these issues early often makes treatment much easier and leads to better overall health results. Screenings are quick, routine, and often painless. Many can even be performed by a nurse during a regular visit, making them very easy to fit into your busy schedule. When it comes to your heart and blood, there are 3 key checks. Blood pressure should be checked at least once a year. Cholesterol should be tested every 5 years, and blood sugar for diabetes should be checked every 3 years, or more often if your pressure is high. For common cancers, guidelines suggest mammograms for breast cancer every 2 years for those aged 40 to 74. Cervical screenings should occur every 3 to 5 years, and colorectal screenings should start at 45. If you smoke or have recently quit, be sure to ask your doctor about a yearly lung scan if you are between the ages of 50 and 80. Your bones and senses matter too. Women over 65 should have at least 1 bone density test. Annual hearing checks and yearly eye exams for vision and glaucoma are also essential for preventing falls and staying connected. Other important screenings include yearly fall risk assessments, memory checks if you have concerns, annual skin checks, yearly mood screenings for depression, and regular dental visits. Men should also discuss prostate screenings with their doctor. Keep in mind that not everyone needs every test. Your doctor will tailor a list of screenings specifically for your health needs and risk factors. Vaccines are a critical part of protection. For respiratory infections, ensure you get a flu shot every year. Stay up to date with COVID-19 boosters, and ask your doctor about the RSV and pneumonia vaccines. For adults 65 and older, high-dose or adjuvanted flu shots are recommended to provide extra protection against influenza. Other vital vaccinations include the shingles series for those 50 and older, a tetanus booster every 10 years, and a discussion with your doctor about your risk for hepatitis B. Since adults often fall behind on their vaccine schedules, make it a point to ask your doctor which shots you may have missed during your next appointment. To help you stay on track, consider printing a prevention schedule to bring along to your next medical appointment. This is a great way to ensure you have a productive conversation with your provider. Now let's move to our second area of focus, staying strong. Frailty is a state where the body loses its reserve strength, making it harder to recover from small illnesses or stress. Signs of frailty include feeling weak, losing muscle mass, tiring easily, walking slower, or unexplained weight loss. While common, frailty is not a permanent part of aging and can often be prevented. Moving on to our third area, preventing accidents. As we age, our risk of accidental injury, especially from falls, increases. However, many of these accidents can be prevented through simple, proactive changes at home and on the road. Falls are a primary safety risk. To prevent them, stay physically active to maintain your strength and balance. It is also important to regularly review your medications with a doctor, as some can cause dizziness, and have your vision and feet checked. Your home should be your sanctuary, not a hazard. Check your water heater to prevent burns, ensure smoke detectors are working, and remove tripping hazards like loose rugs or cords. Good lighting and properly installed grab bars can make a big difference. Driving safety is another critical concern. Always wear a seatbelt and keep up with regular vision and reaction tests. If you find driving difficult, talk to your doctor about how your health might be affecting your safety on the road. Our fourth area is ensuring safe medical care. While medical treatment is meant to help, it can sometimes carry its own risks for older adults, often referred to as iatrogenic harm, which stems from complications or side effects. Older adults are more sensitive to medical risks due to lower physical reserves, the use of multiple medications, and fragmented care between different specialists. Being aware of these challenges is the first step towards safer, more coordinated care. Polypharmacy, or the use of multiple medications, is very common. Because this increases the likelihood of side effects and dangerous interactions, it is essential to manage your medication regimen carefully with your doctor. To protect yourself, keep an accurate, updated list of all medications and supplements. Use one pharmacy if possible. Ask your doctor about the necessity of each pill, and never stop or change a medication without medical guidance. Coordinated care is vital. Consider working with a care coordinator or a geriatric team that looks at all your health needs together. Pharmacists are also great partners for spotting potential medication issues. Finally, we focus on our fifth area, emotional and social well-being. As we age, it is natural to experience losses that can affect our mood. Prioritizing your emotional health is just as important as maintaining your physical health. Aging often involves changes like retirement, a loss of independence, or the absence of longtime friends. Recognizing these transitions helps us understand that feeling low is understandable, but persistent loneliness or sadness is not normal. Depression is common in later life, yet highly treatable. Don't hesitate to talk to your doctor or a trusted friend if you are struggling. Reaching out for professional support is a strong, healthy step toward feeling better. Staying connected is powerful medicine. Make time for regular calls and visits, join groups or classes, and find purpose through volunteering or hobbies. Active social engagement helps combat loneliness and keeps your mind sharp and resilient. To caregivers and families, your support is invaluable. You can help track appointments, spot subtle changes in mood or mobility, and encourage healthy habits while respecting the independence of your loved one. Thank you for watching. Remember, this guide is for educational purposes. Always discuss these steps and recommendations with your personal healthcare provider to ensure they are the right fit for your unique health needs.